Imagine stepping into the field of clinical genomics, expecting to spend endless hours buried in research papers, meticulously organizing patient data in spreadsheets, and writing Python code deep into the night. I certainly did, but I wasn't prepared for one crucial skill I would soon need: listening. That revelation came when I started working with clinical notes. These notes are often chaotic, deeply personal, and patchy records left behind by doctors, far from the neat data tables I expected. But hidden within these fragmented narratives lie vital hints. A family history of breast cancer, the presence of a BRCA1 gene mutation, or a subtle tentative mention of a diagnosis. These tiny clues hold immense power, influencing diagnosis, patient care, and medical breakthroughs. Here's where it gets tricky. Finding these clues by reading thousands of notes manually is incredibly slow, prone to human error and heavily dependent on the reader's judgment, which can vary. That's when artificial intelligence, especially a branch called natural language processing, NLP, emerged as a game-changer in my work. As a bioinformatics graduate student at Michigan Medicine, I develop hybrid NLP systems that blend the precision of structured data with the richness of narrative text. These algorithms are designed to understand the subtleties of medical language. For instance, they recognize that the word positive doesn't always mean good news, and how no history might actually be a critical warning sign. Our systems bring together traditional machine learning tools like conditional random fields with carefully crafted medical rules and specialized vocabularies, lexicons packed with gene names, mutations, and clinical terminology. These medical rules prevent common mistakes, such as misinterpreting no family history of breast cancer as a risk factor. The lexicons act like expert dictionaries that help the AI extract detailed information on genetic variations, inheritance patterns, and clinical insights from disorganized notes. The impact? Much faster and more reliable detection of patients who could benefit from genetic testing or clinical trials. For example, when a note reads, "Mother diagnosed with breast cancer at 42, patient reports positive BRCA1 mutation," our system immediately identifies this as a high-risk situation and prompts clinicians to recommend genetic counseling or suitable trials. This approach reduces delays, cuts down on subjective errors, and ensures fewer patients fall through the cracks. What truly surprised me wasn't just the effectiveness of these technologies, but how deeply they challenged my understanding of accuracy in medicine. What does it mean for an AI model to be accurate when a simple mistake can mean life or death? In clinical NLP, even a small error, a single misread phrase, can have serious consequences. For example, confusing no history of colon cancer with history of colon cancer could lead to unnecessary procedures or cause genuine risks to be missed entirely. In genetic medicine, such mistakes might delay crucial diagnoses and treatments. There's still much work ahead. My current focus is on evolving these tools from simply extracting information to actually interpreting it. Imagine AI models that don't just spot genetic risks, but also summarize their meaning in a way that's clear and actionable for clinicians. Or tools that could uncover disparities in who gets access to genetic counseling and care, highlighting gaps in our healthcare system. AI hasn't replaced the human element in my work. Instead, it has transformed the way I approach it. It has made me more meticulous, collaborative, and inquisitive. In a field where every piece of data represents a real person, AI's greatest lesson for me has been teaching me how to truly listen.